Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I'd like to share an audio with you that's from the Municipal Labor Committee's meeting. There's several parts of this that I want to be able to share with you, especially important for New York City Council members. We're aware that the Municipal Labor Committee and some of our unions are sending you opposition memos. We're going to start to debunk that right now. The unions do not collectively bargain for those people already retired. They can represent and collectively bargain for those in their bargaining unit, active workers, and their future retiree benefits, but they cannot collectively bargain for me. I am retired. I am not in their bargaining unit. That would be like saying that Henry Garrido of DC 37 or Michael Mulgrew from the United Federation of Teachers can collectively bargain for another group of employees that's not in their union. I'm not in their union. That's like saying Michael Mulgrew can collectively bargain for plumbers, or Henry Garrido can collectively bargain for teachers. He can't. They can't collectively bargain for those that are already retired. This is why the City Council has always protected retirees. We don't have a bargaining unit. We don't have a bargaining agent. We are not in an organization that permits collective bargaining. The city and the state don't permit collectively bargaining. So I want to listen to this audio, and then I'm going to explain it.
You have Harry or someone there, legal, maybe Alan, just explain it in further detail and expound upon how it's going to affect collective bargaining rights.
It freezes health benefits to where it was in December 31st.
That's not true. Our legislation requires that the city provide a supplemental plan, a Medigap plan, that was like what was in effect on December 31, 2021. It doesn't freeze healthcare. It doesn't freeze collective bargaining or negotiating. It specifically states that the city must provide a Medigap plan like what was in effect on December 31.
It obligates a Medigap supplement plan without saying how it would be paid for.
And that's not true either, because since 1967, when 12-126 was legislated in the administrative code, the city has been paying for Medigap plans or any cost to a Medicare retiree. Why? Because the city is required to pay up to the HIP HMO rate, and our Medigap plans are under the HIP HMO. That's why the city has been paying for Medicare eligible retirees out of the general budget. This does not get paid by the unions, and it does not get paid out of the stabilization fund. Unlike the teachers, DC 37, fire, police, etc. Their premium differences between HIP and GHI are paid out of the stabilization fund. Medicare eligible retirees don't get paid by the unions, and they don't get paid out of the stabilization fund.
And concern is that the city will then adversely impact other aspects of healthcare for actives and others because of that.
And so the one line in the legislation that speaks to it not doing that. What do you think the effect of that line?
And what he's referring to is the second line of the legislation. So the first line is a two-line legislation. The first one says the city must provide a Medigap. The second one says that nothing in this bill prevents the unions from collectively bargaining for their unit members, right? We're not a unit member. We're not a union member. We don't collectively bargain. They can't collectively bargain for us. Our bill does not affect them. They can negotiate anything they want. Why? Because they collectively bargain. So this representative from the PBA is actually asking, well, what are you making out of this bill? The second sentence says it doesn't do that. What do you think the effect of the line is? That's the reference. Wait for the answer.
Does it will not affect collective bargaining? Is that throw away the line?
Yeah, but it can't by itself determine what happens for actives. But what it'll do is put enormous financial pressure on what the city says to us it's willing to pay for actives if they have to pay so much more for retirees.
And right there it is. This bill cannot affect the actives. Coming from the attorney for the MLC, Alan Klinger. He represents the MLC, the United Federation of Teachers, some unions in DC 37, sanitation. There's so much conflict going on right here. It's unbelievable. But he just let it out of the bag. The MLC, the active unions, do not collectively bargain for current retired persons. This bill cannot by itself affect them. What it does do, in his opinion, is that because the city is paying for us, Medicare retirees, the cheapest people the city has to pay for, it would mean that it would want to pay for them less because their plans are so much more expensive. Remember, ours are about $200. Theirs are like $1,000 to $2,300, $2,500 a month. We are the cheapest people that the city has to cover. Continue.
That's how we interpret it.
Okay, I just wanted everybody to understand why we're saying that it has impact on collective bargaining forward.
Yes.
To say that to the extent that it freezes retiree bargaining over health, the impacts on any savings that derive from retirees could impact our collective bargaining acts. Is that correct?
Yes, I believe you have it right.
And so there you got it. Our legislation will not impact an active worker. But what he's saying is that in his opinion or in his interpretation, I wonder what the hell he's trying to interpret, that if the city has to pay for us, they're not going to want to pay more for them. This is why the unions have collective bargaining, because if they were really good at collective bargaining, they would have bargained a fix for them rather than having to steal from retirees to finance them. Our legislation doesn't have to finance an active worker. It doesn't have to finance their stabilization fund, none of that. Why? Because our funding was in the budget and it has been since 1966. Our legislation doesn't need to have a funding source. It did until they stole it. City Council, do what we're asking you to do. Protect retirees, because now you're seeing, and this is day one, and I'm going to keep doing these. Every day I'm going to show you that the MLC is lying to you. City Council has a responsibility to protect the retirees. Thank you.